All right, I know most of you guys out there are wondering, what is the actual difference between medical school and chiropractic school? I got a lot of you guys out there that are going to chiropractic school right now watching me, but I have my best friend nearly in the entire whole world. All of my best friends would agree that they're my best friends. Noweed, you subside! Yay! He is in osteopathic medical school, third year, all right? And he's an entrepreneur, +1. We've been kicking it old school for the last almost 20 years, guys.
Yeah, almost 20
Isn't
years.
that crazy? I never thought about that till right now. It's only 2 years away from 20. It's actually only 1 year away for you.
Yeah. That's
We've been friends for 20 years.
Running with our shirts off in cross country.
Dude, that's so crazy to think about. I've known you longest. Of all of my best friends that actually still talk with me, you are the one that I've known for the longest.
That's insane.
I know. It's pretty cool. It's pretty cool. Are you still tripping out about 20 years? Because I would be.
Yeah, I haven't thought about it in a long time, man. I mean, I think back to high school time, and sometimes I still think, oh, maybe that was like 10 years ago. And I was like, wait a second. No, I just had my first high school reunion was like three or 4 years back.
Yeah.
And kind of feels like life is in snapshots, man.
Right. And we're in college, so hey, you would think that we maybe had finished this by now, but but that's why we're best friends, because we just like to feel it out a bit, you know?
Yeah. Plenty of experiences to explore.
Yeah, totally. Well, dude, so how cool it is today that we get to compare notes on how we're learning, how we can help people, compare notes as to the parts of our school that are just kind of ridiculous and have little relevance to what we are learning is happening in the real world, as well as like Noweed is one of the most intelligent people that I know. He's a very deep thinker, philosophical, but also super hilarious. So he's not like, autistic in a way where you're like just talking about numbers, zeros and ones with him. Like he actually has incredibly deep emotions and thoughts, able to take like any question or philosophy and just put himself there, even if he doesn't believe it or whatever. Like your imagination is incredible. And this is why you will ultimately be one of the greatest healthcare providers that we know today.
Thank you, bro.
Yeah, dude, for real. And also, we have a special guest, Nefern, in the background. You want to introduce Nefern?
Yeah. Nefern is actually the first plant that I've had longer than 2 months that I haven't killed. And he's happy. We have a good relationship. I know how to water him the way that he likes. I put him by the window. Yeah. Give him the sunlight that he asks for, and he makes me smile. So it's a good relationship.
Yeah. True. It's true. It's like whatever the scientific word is for an asexual father. Like you don't need to have, you just have Nefern.
That's right.
Yes, exactly. So anyways, come on, guys. We got to get to the serious topics here. Well, first thing would be like, dude, you've been in school for 3 years now. You've got a couple more to go, but you're making it past your big tests into rotations now, right? So these first 3 years, we're preparing you with all the literature that is like baseline level. Hey, this is how things work. And now you're getting into, well, people are going to trust you with some aspects of their health over the supervision with the doctor. What does that look like?
Yes. So over the next year and a half to 2 years, I'm going to be doing rotations, and these rotations are going to be in 1 month increments based on every specialty that is either required, call them your base or your general specialties, and then my electives, which are essentially the things that I'm interested in and are not necessarily a normal part of the normal curriculum. So, for example, starting out, I have my first elective, which is orthopedic surgery. For a month, I'm going to be working with a group that operates in outpatient clinics and also in inpatient settings. And I'll have the opportunity to go and actually talk to these patients under the supervision of these providers and apply some of the lessons that I've learned over the last 2 years to taking their history and their physical. And most importantly, this is about my education. So actually going and presenting to the attendings and making sure that I am learning about this specialty. I'm learning about this patient population, the epidemiology, and the diseases that are associated with this practice, and being able to communicate that back and test my knowledge at the same time, interacting with patients and gaining the experience in communication, right? Because I've literally been in the books for the last 2 years. Who knows if I can even hold a conversation anymore?
Yeah, that's...
And so following ortho, I have general surgery. So general surgery is one of the core rotations that I need to complete.
Mm.
And after these first 2 months, I'm going to be taking a shelf exam, which is essentially a standardized assessment of my understanding on surgery for those 2 months. And then following that, I've got family medicine. That's a 1 month. And then PM&R, which is where my sites are on currently as far as residency options are concerned. And then I think my break time is going to happen in December. I got to actually come out to Georgia. I haven't told you yet. I'm going to be coming out to Georgia, Atlanta for a week because I got to do orientation for the Army.
Oh, sick. You're going to go to Fort Benning?
That's a great question. I think I'm going to Forest Park.
Oh, I wonder what that is. Interesting.
Yeah.
All right. Well, hey, when you're there, we'll hang out.
Yeah.
So when you're in the surgery room, like, are you an orthopedic surgeon? Are you going to be like overseeing them do surgery on people, do you think?
Yeah. And that's one of the benefits of being able to go through this experience in medical school. You have the ability to actually witness these surgeries happening. And for the most part, I mean, we're medical students, right? We're a liability. We don't know what we're doing. So most of the time we're going to be standing out off to the side in the corner with our hands like this. Don't touch anything. Don't look at anything. Don't breathe on anything, and then learn. Yeah. And that's not the limit to it, though. If we develop a good rapport with our surgeons, then maybe we can help actually suture out the ports. So they're putting in a tube or something, and we gotta suture it. We got that opportunity too, or we can just sit there and hold the vacuum for all the smoke for when they are going around and cauterizing all the wounds. So we can interact with it a little bit, but it's really hands off, watch, listen, understand, and be an observer.
Well, that's pretty cool. So have you, in your schooling, did you learn about what kind of surgeries are possible as an orthopedic surgeon, and now you're going to witness them? Or, is it more like you're going to learn that when you're there?
So during school, we cover a lot of procedures that you're going to see in the clinical setting.
Yeah.
Now, that being said, the actual specifics of the procedures and how they're performed and the tools and everything else is something that we're going to be learning on rotations, and is probably going to be a lot more testable in the context of step 3, complex 3, which I'm going to be taking in a year from now. So, for example, the attending that I have for orthopedic surgery coming up, he sent me a text message of the things that he wants me to learn. So he wants me to understand rotator cuff injuries and amongst like surgeries on the knee and different joints, and have a decent understanding of it before I walk into the clinic, because I'm sure you're aware there's a big culture of your attendings just testing you. They want to understand your knowledge. They want to know that you care about this information, that you're learning about it on your own time.
Right.
And so I've definitely got some material to prep before I walk into rotation on Tuesday.
Right. Oh, this will be next Tuesday?
This coming Tuesday.
Dude, that's so cool.
Yeah.
Dude, amazing. That's awesome.
I'm really excited. I'm excited to be out of the classroom, truthfully. The past 2 years were all lectures. It was getting ready for step 1 and Comlex 1. And I just finished those within the past couple of weeks. I finally got my pass for step 1, which thank God I'm very grateful for.
Yeah.
And now I get to go and experience what I came in here for, which is to do medicine, to be with patients.
Yeah, for sure, dude. That's so cool and exciting at the same time. So you said orthopedic surgeon, and then what was the next? Wasn't there a different kind of surgery?
General surgery.
So what is the orthopedic surgery has to do with joints and bones, and general surgery just has to do with like removing organs and stuff? Or
general surgery is, to my understanding, everything in the acute care setting. You're talking about a lot of cancers. You're talking about bullet wounds and trauma.
Hell yeah.
And you're talking about a majority of the cases that are coming into the ICU where people need a surgeon. And the general surgeon is going to cover most things. And then if it's something hyper specific, like you need a cardiothoracic surgeon, well, then they got people for that too.
Huh. That's pretty cool. So then so this is what you're going in for. You're going in to be an osteopathic doctor. You could end up doing all kinds of different things. Is it possible for an osteopathic doctor to do like plastic surgery?
Yes. And the opportunity is there. However, there's a dynamic that's worth mentioning, I think, which is the dynamic between DOs and MDs. Some residencies are historically more DO friendly or MD friendly. So as an osteopathic physician, you're taught a whole body approach to medicine. So a lot of osteopathic physicians will be more pulled towards family medicine, right? Now, plastic surgery specifically has been a heavily MD biased residency for many, many years. And while the sands are shifting, DOs, osteopathic physicians, have way, way, way more opportunities to enter into different specialties, and that has only been increasing over the last couple of decades. Some specialties, specifically plastics, is still, to my understanding, more MD biased.
Do you feel like it's interesting to understand what happens with like the ideologies behind, it's like being a fan of the Dodgers versus like the Giants or something like that, like a football team or a baseball team or whatever, we see it between chiropractic and medicine there's all kinds of people who have beliefs about this or that, and there's conflicts. But what do you see? Is it common for medical doctors to feel like superior in some way, or DOs to feel superior in some way?
This is more something that I hear about rather than I've experienced myself. So, for example, I worked for a psychiatrist for multiple years, and the partners of the psychiatry clinic were one an MD, and then the second guy was a DO, and there was never any difference. I never sensed a difference either between them or from the patients. All of their patients loved them. They loved each other. And there was never even an indication that how they were practicing medicine in that context was being different. So I haven't experienced it myself. Now, what I will say is a lot of people are more unaware of what a DO is. And I think that speaks more to the history of medicine in the United States more than anything else. Allopathic medicine, as in MDs, have been around for several hundred years. DO is still a new philosophy. It's still a relatively new philosophy in the history of this country. And even though our education is the same, the awareness is still growing.
So do you learn that have DOs been around since more like the late 1800s or the mid 1800s?
I believe so. I think the founder was Andrew Still. I'm going to look it up right now because I don't like saying stuff that I don't know.
We learned about him as well.
Yeah, Andrew Still was 1800s to early 1900s. So he formulated osteopathic principles 1874 versus allopathic medicine that's been around since, God, I don't know, however much longer.
Yeah. Well, we learned about Still in it's my understanding that he was very keen on looking at blood, like people's blood, what's in their blood. Did you learn the same thing?
So I don't know about an emphasis on blood per se. What I do know is that blood and lymphatics, just in general fluids,
Right.
are a big foundational piece to the education in osteopathic medicine. And a lot of the treatments that we were taught in medical school have to do with lymphatic drainage. It's actually moving and manipulating a person's fascia and creating space for the body's fluids to drain and to move and to help with recovery.
Yeah. All right, that's interesting. Do you ever I have these like compression boots and arm things. Do they ever talk about people using like compression to move their lymphatics?
Compression? What do you mean by compression?
I'll show you. So essentially, this is just like one boot, but you put your foot in there and you zip it up, and then the other piece is there, but it's air, and essentially it like fills up the boot, but it has these different sections. Like there's 5 different sections in here. So essentially, it compresses in waves, and it can get really, really tight. Like, use it after like a run or any sort of like leg workout or something. But I know I'm pretty sure there's people that like use it if they're diabetic just to get just to move the fluids in their legs if they're have a sedentary lifestyle or something. But I'd be interested to hear more about what you learned on how are you moving the lymphatic system to help people heal.
Okay, yeah, I understand what you're saying. So as far as the idea of compression, that's not something that we were necessarily taught about in our first 2 years of training. But what I understand in the transition from that is when you're compressing the leg, that fluid has to go somewhere, right? Mm-hmm. So when that fluid is moving, there are junctions in our body that our lymphatic system has to move through.
Right.
And so when we're doing treatment on individuals where this is the indication, like this is what we have to address, then oftentimes we'll do myofascial release in the thoracic inlet, because this is where our lymphatic system drains back into our circulation, right?
Right. Right.
And so we'll literally do manipulation over the patient's shoulders and their neck and loosen up this tissue. And then another big place is right under the diaphragm. So
Right.
we'll call it doming the diaphragm. And to help people's respiration and their circulation, we'll literally go in with our fingers underneath the sternum and dig in and actually dome the diaphragm and help it move and react to the autonomic nervous system.
What would be like? That's fascinating, because you're hitting as the idea to hit the vagus nerve, and with the diaphragmatic. Well, I guess the diaphragm is
Phrenic.
3, 4, and 5 phrenic. Yeah. Exactly. So, fascinating. What are you manipulating in the shoulders, or when you're doing the manipulations? Are you like, how are you manipulating people?
So we call it myofascial release, MFR.
Yeah.
And so with MFR, the way it was explained to me, it's kind of like driving a car. Imagine that the patient is laying down and I've got my hands on their shoulders. I'm feeling the tissue, and we have direct and indirect approaches in OMM. So a direct approach is something that's going against a restriction. So the direction that the body is, call it stiff, right? And then an indirect approach is the direction of ease. It's what direction does the tissue want to go? And so a lot of our education is about using our hands, similar to chiropractic, as I understand, right?
Yeah.
It's about feeling the tissue and diagnosing it based on how it literally feels. And so you're going in and you're starting to move around this tissue. You're feeling the texture, you're feeling the warmth, you're feeling the fluids, and then you're helping guide that tissue either in the way it wants to go or the way that it's against, depending on the indication, like what's causing the patient pain. We're not trying to do a treatment that's going to cause them pain. This is about relief. There's multiple ways to treat the patient without just going against the barrier of restriction and making them uncomfortable every single time. And then over time, through the manipulation, we call what happens is we literally feel a release. And so you'll feel what we call tissue texture changes. So as you're going through the manipulation, you'll say, oh, okay, yeah, I feel that there's more blood. Like there's actually more warmth in the tissue. There's more flow of fluids coming in, and the circulation has increased. You'll even ask the patient, hey, like, are you feeling better? And a lot of the times it's an immediate relief. It's an immediate relief. And then the lasting benefits, of course, are going to come with treatment over time and diligence. And people have to also take in consideration their own lifestyle choices. All of this matters.
Right. All right. Fascinating. So are you grabbing like grabbing the shoulder and pulling, or is it more of like a skin pull with the fascia that you're focused on, or just literally just creating some movement?
You could think about it as movement. I mean, I had 2 years of OMM, and that being said, I just want to say this as a preface, right? Like, I love and I appreciate OMM, and I'm grateful for the experience and the knowledge that I have had in doing it. Though OMM is
what is OMM? Can you define the words of it?
Yeah, absolutely. Osteopathic manipulation method.
Okay,
So OMM is something that you actually go and do a fellowship in, so that you can learn it in its in its practical sense. So everything that I'm explaining here, it's observing and actually practicing it on my peers. Though my knowledge is so limited. So I just want to say that in the context that it is an actual profession
Yeah.
within the context of medicine, and so I can give the knowledge to the best of my ability.
Right.
Though when it comes to a lot of
Like the specifics of it.
the specifics, yeah, I don't want to claim that I have that I have great knowledge at all. I passed my exams, thank God.
Yeah.
But that's all I can say about that.
Yeah, that's all right. No worries. No worries. Okay. Yeah, no worries. All right, cool. Well, so you're learning how to touch people, which is cool. And then what would you say the top 3 subjects that you really dive deep into are?
So a huge part of medical school just in general is pathology.
Right.
And so my entire second year was pathology. And it was pathology going through every major organ system. And so I would say that, like, as far as big categories are concerned, pathology. And that's even reflected on the boards. Our board exams are like 45 to 50% of pathology.
For sure.
And then after pathology, I would say OMM, frankly, because we had OMM every single week of my education over the last 2 years. And it doesn't end. I need to be able to retain this knowledge so I can pass my boards for Comlex 3 or Comlex 2, excuse me. And then if I wanted to pursue it more, then I could go and actually do a fellowship in it later. Now, other than pathology, OMM, then I would say just generally physiology. If you're thinking about the big categories in medical school, my entire first year was all the foundational knowledge. So
Right.
not just physiology per se, it was a lot of immunology and microbiology and MSK, and then biochemistry,
Musculoskeletal.
genetics. Yeah. But as far as like big category is concerned, I would say physiology, pathology, and then osteopathic manipulation. Call that the big 3.
Yeah. I think that there's a similarity for sure. I mean, as a chiropractor, we're touching people all the time, so that's like the whole profession, right?
Yeah.
So there's a lot to do with understanding that. And then we have pathology as well, but related a lot. We have pathology 1 and 2, but as specific pathology related classes. So we're not taking a whole year really just for all of pathology. So you probably have a lot better understanding of different kinds of diseases and identifying them than maybe a chiropractic student would. But we study a lot of diseases that would be connected to the nervous system. I mean, it's not necessarily called a pathology class, but I mean, our organs are connected to the nervous system. So, a lot of people think that chiropractors are just figuring out how to like manipulate the spine, but really we're focused on what's in the spine. That is really what's affecting people's health. And, again, this is where I said at the beginning where we may be learning things that aren't as applicable as what we would practice out in the real world in school just to get past, some of these boards, they can keep it pretty general. I mean, just talking about general truths about the nervous system, but, do you find like we do that there's, a high degree of specialty that you can have as an osteopathic doctor? And through residency, I mean, is residency like the gold standard for understanding where you'd like to go? Because in chiropractic school, you have to just go seek out other professionals and essentially like pay for classes and maybe show up to a few of them for a few years in order to actually study them. I mean, we also can work for another doctor. We don't have residency for the same, of quantitative time that you guys are required to do it.
Yeah.
I mean, but what is it like for you going into a residency? Obviously, you're picking your specialty, but is the idea that once you pick your specialty, like you find the person that is incredibly skilled in what you want to learn, or you still also have to go seek out further knowledge after school and the residency?
That's a great question. So the way I've always been explained medicine, the way medicine has always been explained to me and the way that I understand it is that it is in itself a true apprenticeship model. And what that means is you are always learning by the fruits of knowledge of your superiors, of your attendings. Now, in the context of where I am now, rotations, I'm going to be rotating with many, many different specialties, from OB-GYN to peds to ortho, general surgery, IM, family, PM&R, psychiatry. I'm going to be experiencing so many different specialties, some practices that I've worked in before, psychiatry and derm, but most of them I have very little experience except for actually going and seeing a specialist myself or seeing my family doctor every once in a while. And during this time, the responsibility falls on me to understand what it is that I want. And I'm looking at a bunch of different things. I'm looking at the actual medicine, the actual knowledge base, the patient demographics, whether it's inpatient or outpatient, or the time that I'm going to be spending, or how I'm going to be using my hands. All these things matter. Now, all of this information and all of my preferences are going to pull me towards a path that I believe is meant for me. And once I choose that, I'm going to be applying to residencies. And when I apply to residencies, I'm going to be saying, hey, okay, I want to do PM&R. And then if it's not PM&R, I'm going to be doing ortho. If it's not ortho, it's family or it's internal medicine. And I'm going to be ranking this. Now, say I am a competitive applicant and I get my first pick. And my first pick happens to be PM&R. Now,
can you define what PM&R is for all the people who are not knowing what that is?
Of course, yeah. So PM&R is physical medicine and rehabilitation. You're working with patient populations who have undergone either serious trauma or neurocognitive disorders, and you're helping them through and manage their treatment plans and collaborating with a lot of different healthcare specialists. So you're working with PTs and OTs, speech pathologists, and helping these people increase their quality of life. And frankly, I would say all physicians really align on that category, right? And even chiropractors.
Yeah.
And so when it comes time to actually choosing my residencies, the question now becomes, okay, well, what program? And that is really where, to my understanding, the opportunities really open up for me to go and subspecialize. So just to give an example, say I want to do internal medicine. Internal medicine, you're a hospitalist, right? You're working in the hospitals. When a patient comes in to the hospital, you're the guy that they're seeing. You're the guy that's rounding on the floors and you're taking care of people. Now, from IM, you have the opportunity to go and do many different fellowships. So you can go in cardio or GI, renal, kidneys, and for example, or respiratory. And now, if I wanted to go into GI is a really competitive specialty, but I'm choosing my IM residency. I should be choosing a residency that's going to bring me closer to that goal. Either they're doing research or they have a fellowship program for GI that's somehow connected to that program. And that gives me the ability to follow and pursue my dreams. Now, even in the context of PM&R, there are multiple subspecialties within it, including pain and spine, amongst many other things. So I really have yet to even explore what this looks like. And I'm hoping during my fourth year, when I have the opportunity to go and do my elective rotation. So I'll explain what that means in a second. When I do my elective rotations, I'll be able to go and travel around to different cities and go visit different programs and find the best fit. And it might come down to the attendings, the actual physicians that I'm learning from, and me saying that, hey, I love this person. I love how this person practices medicine. I love what's important to them. I love their philosophies. I love how they treat their patients. I want to learn from this person. And I, in other words, I want to be this person's apprentice.
Right.
And then I choose that on my list and say, okay, that's where I want to go. I want to go to that program for these reasons. And if that match happens, they want me, they like me as an applicant, and I want them, then that's where I'm going to be spending the next 4 years of my life actually learning the medicine, actually learning that discipline.
And that would be the residency?
Yep, that would be the residency.
Cool. So wait, let me just clarify this for myself. You have to be accepted into a residency.
Yep.
And so there's a finite amount of doctors, right?
Sure.
That are accepting new doctors. What do you call yourself at that point? Residents?
Yeah, resident.
Yeah. So then so now I have a question for you. Let's say you go, you're very clear on what you want. You want to do the PM&R, and then you're like, okay, I know I want to do this. If I can do this, then you have to go. Is it all over the world? Can you go anywhere in the world?
Theoretically, yeah, you could go anywhere in the world. Now, I don't know of many contexts where people would choose to do their residency other places in the world. If anything, people around the world are coming to the United States to do the residency here.
And the same would be for chiropractic too.
Yeah. So the United States, to my understanding, still has one of, if not the best pathway to medicine in the world. So you have medical school graduates from all over the world that are taking our licensure exams to come here and do their residencies here so they can practice medicine. And then at that point, once you're licensed in America, okay, fine. Yeah, do whatever you want.
It's like a passport to the world.
Pretty much, yeah.
Yeah. That's kind of how chiropractic is as well. Okay, so then let's say you're like, all right, well, I know what I want to do, but then personally, like, what is the choice you're going to make? Are you going to value what you want to learn versus, like, obviously you have incredible family values for you. Those of you that don't know Naweed's family, if Naweed's family is watching this at some point, they are incredible. And there's no real reason why you'd want to be anywhere away from them. But I'm curious, what would you value more? You know, like if the decision comes where you're like, all right, well, maybe you are a top candidate, and there's just like the guy who's the best, because I imagine that you seek out that person, and you're like, all right, this guy is like 100% aligned, or girl, with what I'd like to do, but they're in, you know, Anchorage, Alaska, or like Missouri, or, you know, Kentucky or something.
Yeah, that's a great question, man. I mean, I've lived in Vegas almost my entire life, right? And I'm here because of my family. I pursued medical school here because of my family. And ultimately, I do want to live close to my family. Now, I have to, and I say it like this, my life is also my own. And I want to be the best physician that I possibly can be. And my family has been nothing short of supportive at any and every given stage of this journey. So if I found a residency that I truly fell in love with, because that is the kind of doctor, the kind of man that I want to be, then I would feel an obligation to go and pursue that.
Right.
Now, granted, it's still, 2 years away. There's residency options here in Las Vegas as well. And who knows, it might be that the residency of my dreams is a 30-minute drive away from my house.
Yeah.
If that's the case, fantastic. That's another 4 years that I get to spend in the same city as my loved ones. And
Yeah.
if not, then it's 4 years that I spend somewhere else and still with the love of my loved ones, the love and support of them.
For sure. For sure. So best case scenario for what you're hoping for is to get a residency with exactly what you want in Las Vegas.
Sure. Yeah. If that exists, if that's here, we have wonderful residency options here in the city. And if they find me to be a suitable candidate, then I would love that opportunity. And if it turns out that I got to go to California and hitch a ride on the beach somewhere, then you know what? I'm not going to be upset about that either.
Yeah, totally. You're gonna have to go to Nantucket.
Yeah, exactly.
Yeah, or something. Portland, Maine. How about
Yeah,
that?
sure. Why not? Why not? Send me to Rhode
it's
Island.
only 4 years. It's only
Doctors
4
are.
years.
Yeah, exactly. If that's where the best doctors are, send me there.
Yeah, I feel like that too. Well, a major difference between medical school and chiropractic school, we have what we call PEAK. I don't even know what it stands for. It's I'm not even gonna try. I don't even know what it stands for. We just call it the PEAK.
Okay.
But that's like we have 2 quarters, so 6 months of rotations is essentially what it would be. You can pick 2 practices, like 2 chiropractic practices. Well, actually, you know what? It may even be different, because have you worked in like a clinic at your school?
No.
Okay. So for us, we start going into the clinic, I think after the first year and a half. So like, I think I have 1 more quarter, or next quarter, we actually start going into the clinic and start working on students. And then like after 1 or 2 quarters of that, then we actually start working on the general public for like a year or a year and a half at the school. So maybe that would be similar to a rotation. There's a chiropractic practice, quote unquote, at our school, and it serves, a lot of different communities. But there are chiropractors who practice different types of chiropractic. So, some chiropractors take x-rays, some don't. Some people use different tools to manipulate the spine, others don't. So you can kind of like go to this clinic, and you are adjusting the people, you're adjusting patients. There's a requirement. You have to adjust a certain amount to pass. And you have to find them too, which is also kind of a fascinating aspect of it. But, some of the doctors will allow you to practice whatever type of chiropractic that interests you the most under their supervision,
Yeah.
which is kind of cool. So we learned that. And then after all of that, we then go to have 6 months of working in a practice with a doctor that's qualified to teach students. So, I mean, you're in a real life practice, and it could be anywhere in the world, So sometimes people like to just pick Europe or something because you're in school, but you get to go travel somewhere and then just like go around and do whatever you do, you know?
That's cool.
So, yeah, I mean, 6 months is not nearly enough time to really, for most people, to really get an understanding of how to run a practice or whatever.
Sure.
So some people will go find someone in their home state, or some people will go try to find like the person who's going to teach them the best. Everybody's got a different flavor. You know what I mean? Some people don't want to go away from home. Some people just want the best education. You know, some people have no idea what they're going to do. You know, we have some students who go through those 6 months and then they have no job. Like, I don't even understand how that could be possible. Like, if you could pick, like, for me, if I was going to look for a job to work for somebody else, like, I would just choose that person during those 6 months. Granted, you could really choose anybody who's qualified, or, you know, they basically just have to be a chiropractor for 5 years. And, you know, there's other criteria, but there's like a time limit. So you can't just go work for your buddy who just got out of chiropractic school, kind of a thing, you know? But it's crazy because there are students who just aren't taking steps to even find a job, like to even just be an apprentice, or, well, they don't call it apprentice. It's like an apprentice, but it's like a contract chiropractor. You just, you work in someone else's business. Yeah. You're just another adjusting doctor in their workflow, you know? So it's fascinating because obviously you guys are more locked in. So once you're a resident, do you have the title of MD?
So I'd be a DO.
I'm sorry, a DO,
yeah,
right?
No, of course. To my understanding, at that point, I am a physician. Now, once I'm a resident, my first year, I guess it's a term that is not being used as much, but in the past, they called your first year your intern year. And after your intern year, and around that time, you would take your third licensure exam during your residency. Once you pass that licensure exam, you've officially completed all of your licensure tests, right, to be a physician. Now, I don't know, like at that point, okay, I'm a DO. Now, I still have to finish my residency. So actually, frankly, this part I'm a little bit unclear about, specifically your question, because once I finish my residency, I know now I'm an attending. As an attending physician, I can practice on my own, open my own practices, get my own insurances, and be my own. But I have to complete my residency. So before that point, once I'm a resident, people are calling me a doctor. As soon as I graduate medical school, you're a doctor. Now, does that mean that you're a licensed practitioner? Not until you finish your residency, I believe.
Right. Crazy.
Yeah.
Yeah. So there's definitely more. There's definitely more time that's required in order for you to get a DO or an MD degree, for sure.
Sure.
For sure. You know, I was looking at comparative schooling the other day. Somebody posted a picture of like what is the difference between chiropractic school and medical school, like what the focus is, and on the thing it says that you guys take like way more classes on physiology. You know, and then for us, you know, you guys have more on pharmacology, obviously, and then
tons and tons of pharm.
Yeah. And then for us, it's super heavy in nervous system, musculoskeletal stuff, and radiology.
Yeah.
You know, taking x-rays, like pathologies on an x-ray.
Yep.
You know? So fascinating. But then it shows like the core curriculum classes are very much similar the chemistries, the biologies, all kinds of anatomy and physiology. Like there's a very similar core curriculum and amount of hours of school that's the same. And really the biggest differences come with you guys being experts in pathology and in pharmacology, and then us being experts in nervous system, and x-rays would be like the subset of that, you know? So it's kind of fascinating. But the requirements for specialties, what I really appreciate about the medical industry is their ability to delineate titles of specialties in the public's eye. Yeah. Because the problem that I feel chiropractic faces is you think, okay, well, I'm going to go to the chiropractor. Well, you may not know this, but there are so many ways to be a chiropractor, and not all of those ways are actually equating to the same outcome. And they can be vastly different. A chiropractor who takes x-rays is going to approach a patient with very different eyes than somebody who doesn't take x-rays. You know, we had a debate in our class the other day. I'm getting on a few topics. Let me just close off by saying that I really appreciate what MDs and DOs do as far as specialties, because there's in the eyes of the public, you could go to a podiatrist, you could go to like an osteopathic knee surgeon, like he's just the DO knee guy, you know, like, and it's on their title, you know, like they're like, I am a, you know, not a dentist, but a urologist or an endocrinologist, and people like know what a cardiologist, they know what that person does. Yeah. You know? So in chiropractic, there are people who, you know, somebody who's doing family practice and a heart surgeon are like, although they share the same baseline education, are vastly different in their scopes of practice and their ability to help a specific person with a specific problem, you know? Like if you go to the cardiologist, you could probably ask the cardiologist about certain pathologies. He's probably going to remember some stuff from school and be able to still help in some way, but you're not going to ask a family doctor to cut your chest open and put a stent in your heart. Yeah. You know? And there are distinctions in chiropractic that are like this, but you call the brain surgeon chiropractor a chiropractor. You don't call him anything other than the chiropractor. But then there's like a family chiropractor who you also call a chiropractor. So in the eyes of the public, like our industry is, to me, missing the mark on labeling specialties in chiropractic. And I think that the medical industry does an incredible job of doing that, because people aren't confused. They know they need to go to a specialist because they have a certain problem. You tell somebody to go to the chiropractor, and you could have 100 people in a room. Half the people may not even know what the hell a chiropractor does, never been to one, even more actually statistically. And the people who have may all have a completely different idea of what should happen when you walk into a chiropractor's office.
Interesting. Yeah.
Isn't that interesting?
Yeah.
Yeah. So, in school the other day, we have a debate class. Do you have philosophy classes in your school?
No, we have to learn ethics and communication, but not necessarily philosophy.
Yeah. So the challenge that is in our profession right now is that there's like, throughout history, there has been qualms between the medical profession and the chiropractic profession, like big class action lawsuits. The medical industry has at different times paid to to essentially ruin the name of chiropractors, like a defamation lawsuit. And they were found guilty on a couple of accounts, where the American Chiropractic Association, or actually there was just five chiropractors who were just kind of tired of what was going on. They decided to pool all their money and resources together to fight the American Medical Association and the AMA and another one of the big medical groups. And they were found guilty that the American Medical Association and this other one had spent, millions of dollars to try to ruin the chiropractic name. And also at the beginning of chiropractic in the early 1900s with, what was that guy's name? The DO?
Andrew Still.
Andrew Still. There was like qualms between D.D. Palmer as like the chiropractor equal to Still.
Okay.
And there were rifts at that time, and because of the pharmaceutical industry coming up in the early 1900s, there was also another occurrence of just like the chiropractic group and profession just like not having their shit together, and then the medical profession trying to capitalize on a kind of like a divide and conquer aspect of it. So what's happened is a result of a very short profession. Chiropractic has been around since 1895, so not much less than DOs. Mm-hmm. But the chiropractic profession also, like in its time, has had so many attacks on it from people on the outside, as well as chiropractors on the inside. Like chiropractors having qualms with each other. And the debate in school is a long-winded way of getting back to this debate that we had in school, is talking about universal intelligence. And the reason that there's been such a qualm for chiropractors is that D.D. Palmer was a very spiritual human being. And so it was him essentially writing textbooks and claiming that chiropractic has an ascension proponent of connecting man to God. And essentially that the power that has made our body heals our body. So when we focus on taking stress off the nervous system and the spinal cord, that our body has a natural ability to heal itself, which is the truth. So in chiropractic, there's this debate between does universal intelligence exist or not? And it's kind of a fascinating place to be. I've had different people on my podcast who are like super philosophical. This is why I asked you, do you have philosophy classes in DO school? Because I just don't know. Because we do. We have 4 quarters of philosophy. And we learn about medicine from like back when Socrates was around. Mm-hmm. And we take medicine back and healing back all the way to as far as history can take it. And we learn how it's changed through the eyes of the public. And, it takes us a whole quarter really to get to just chiropractic, which is cool to learn so much about what we've done throughout all of time to try to help to heal each other, from people used to puke inside bowls and jars and would urinate, and they would mix it all together and look at the color, and based on the color, like they would say, well, this is happening or not. Or they would bloodlet, for a very long time. They used to just bloodlet everybody. And The ironic part is they thought it was working because for 50% of the people, it really did help a lot of their ailments. But the other 50%, it just did nothing. So anyways, talking about universal intelligence, or our ability to heal through light, being like laser treatments. Like nobody can deny nowadays that we use light to heal each other. It's a laser beam. It's just light. It's focused light. Light heals our our cells and tissues in so many ways. Or like acoustic waves, like they have machines that send an audio impulse into injured tissue, and essentially it has a reaction with your cells and helps to put stem cells in injured tissue. And it's like the injured tissue has a frequency of, a low frequency. This audio impulse is a high frequency. And so when they clash, essentially it sends like pain signals to your brain, and then your brain will release stem cells to help heal the injured tissue. So, I mean, you see this in these kinds of machines in rehabilitation centers all over, whether it's chiropractic or medical rehabilitation. They use laser beams to like help scars heal way faster in surgeries. And anyways, the point is that we're using all this energy to help heal each other. And in chiropractic, the founder of chiropractic's like, well, if I adjust people, then that opens up our ability as electromagnetic beings, and physics heals our body. If we raise the vibration and the frequency of our body through the nervous system, then our body has a greater ability to heal. So part of the reason why some, or a significant amount of people may not take chiropractic seriously, or the term quacks was created by the medical industry in the 70s as part of the deformation. So now we have the quack label, but really it's because these chiropractors get so into their own religion and their own faith, which could be Christian, some subset of Christian, which is what the D.D. Palmer believed in. And then it brings this religious component into health, which is like, okay, well, there's segregation in our own profession because people are arguing about, do we talk about the religion or not? When really it's like one of the greatest philosophies that we see that is able to help people in a way that doesn't involve cutting them open, and or using pharmaceutical drugs. This is the whole point of a lot of chiropractors' mindset, is they want to try to do what they can. And obviously there's like a threshold where people are, eating terribly. They have incredible metabolic issues. They have sedentary lifestyles. Like, there's only so much that a chiropractor can do in some cases, that, you have to have medicine to be able to pick up the pieces. You can't get into a car accident and have a bone sticking through your skin and expect to go to the chiropractor. Like, that's, so I've just said all these things to bring into light, like, do you think that having a spiritual foundation, you have a very, very solid spiritual foundation, and for our entire friendship, you've always had an incredible spiritual foundation. Do you think that there are benefits to having a spiritual foundation regards to healing? Not saying that whatever you say is how you will practice or whatever, just like understanding, like, do you feel like having a spiritual foundation can help people's physical bodies heal?
Yeah, absolutely, man. I of course, I'm being licensed as a DO, and
Right.
I love medicine in its true purpose, which is to heal. And the word heal, as you alluded to, in history has meant different things at different times to different people. And I can speak in the context of my own life that, and oftentimes, and in the lives of my loved ones, that when there was some ailment, some stress, physical or mental or emotional, the thing that loops everything together is the spiritual. And oftentimes it's about, I think, our worldviews. A person who doesn't believe in something greater than themselves oftentimes loses the scope of purpose or even a belief in a goodness in the future, a hopefulness. And you could call hope itself being a medicine. You're not going to find it at the pharmacy, right? Or you're not going to find it in a bottle, but you are going to find it in your beliefs and in your faith and in this clear understanding that, you know what, no matter what it is that I'm going through, everything's going to be okay. And if you believe that, and then also believe, you know what, even take it a step further, I am going to be okay. It is okay. I will be okay. Then say, just take an example, just take into consideration somebody that lost mobility. And essentially that's the patient population that I'm hoping to be working with, people that have undergone some serious trauma or some drastic change in their life that has affected them so much. I want to help these people have hope. And my spirituality is my own, right? And that's the society that we live in. We live in a society where we don't share we don't share our spiritual or religious beliefs, or if we do, then we do with a small subset of the population, and that's okay because we can still encourage people and we can still call them towards the things that they love. And even that in itself, I think, is speaking truth to the spiritual context and say, okay, what is it that you're living for? What are you fighting for? And sometimes people are so deep in the weeds of their own minds, maybe from the trauma of their lives or whatever past experiences, that they might say, I don't have anything to live for. Okay, well, let's talk about it. Do you got a dog that you love? Do you love your parents? Do you love your kids? Maybe it's the dream of, even at the lowest sense, it's a dream of just being able to have the mobility to go and hang out on the beach and just go and chill and enjoy that. So let's focus on something that you love. Now, for me, that love for myself is my relationship with God. And it's wanting to serve Him and understanding that whatever it is that I do, whatever it is that I pursue, so long as it is for His sake, I'm going to be okay. I'm going to have peace in my life. There's going to be blessings in my life. And from that, I'm also going to be a better physician because I love and care for people. One, because it's the right thing to do. And most importantly, because it's pleasing to God. And I know that if I do that, then I am going to be okay. I'm going to be okay in the eternal sense and the infinite sense of being and of my life and spirituality. And while I wish that maybe even our medical system was a little bit different, we live in the reality that we do, which in this country specifically, you have people that love and will talk about spirituality and other people who don't. And medicine kind of falls, I think, in the middle of that, where we practice evidence-based medicine, right? And that's, I feel like, exactly how it should be, though it also, in the same breath, does not have to be independent of one's spirituality. If anything, to answer your question very directly, I think it would benefit people a lot. And to just go back on my previous point, in my own practice, it may not be that I'm not going to be going around and calling my patients to God, right? That's an obvious violation of like my own principles,
Yeah.
and let alone the principles of being an osteopathic physician. But I am going to call them upon hope. I'm going to call them upon thinking positively and working towards a future that they want and towards the love that they want, and helping them heal through love and support and encouragement, and through all the things that I believe in, all the things that are empowered, that empower me through my own relationship with God.
Yeah, for sure. Well, I appreciate that, because I share a similar belief. There's my motion in this debate. The debate bluntly was, does universal intelligence exist or not? Now, universal intelligence is defined as an energy greater than all of us that connects everyone together. And in chiropractic history and different ideologies, universal intelligence has been compared to God, a Christian or a monotheistic God. Now, we have something that we also call innate intelligence. And they make a difference between universal intelligence and innate intelligence. And we learn the innate intelligence is our body's ability to heal itself with no intentional thought. Like if somebody has a neck curve, my neck is supposed to curve this way, like that. Now, because of technology, everybody looks down. Sometimes that neck curve that should be like this ends up becoming straight or even reversed in the opposite direction.
Yeah.
Now, the reason I'm saying that is because there's a threshold of like a measurable threshold of what will create a physical pain. 9 times out of 10, it's a 20, like you're supposed to have a 40-degree neck curve. Let's just say some of you see the chiropractic biophysics guys will be like, well, if you measured a certain angle, it could be different. That's true. But generally, you're probably going to have somewhere between a 30 and 35-degree neck curve, negative 35-degree neck curve. And essentially what happens is as that flattens out to about less than 20 degrees, we understand that all of these physical pains or pathologies will come. That's the threshold. If it straightens out, then your body is going to experience these sorts of ailments or symptoms. And then essentially, if somebody's less than 20 degrees, if you get them to have a more than 20-degree curve, our body spontaneously remisses those symptoms, where this is the innate intelligence that I'm talking about. It's like, hey, if we take stress off of the spinal cord, our organs function better. That's like the most plain and simple way to say it.
Yeah.
There are, somebody's head could be to the right or the left. That's going to create problems up and down all their organs. We find that people who have, we call it a subluxation. Essentially, if we have 2 vertebrae and one of them shifts out of place, then the spinal cord's in the middle. And so it's like stepping on a garden hose. If you're watering the gardens and you step on the garden hose, then the water stops flowing. Yep. Well, the same is true for the energy that goes from all of our organs and tissues in our brain. The messages go back and forth. So innate intelligence is our body's ability to process the information and regenerate with healthier, stronger cells. Universal intelligence is our interconnectedness as one. And the conflict in chiropractic is going, well, does universal intelligence exist? Should it exist in chiropractic? Should we even talk about it? And I agree with you where my statement, well, I was for the opposing team because it's contrary to my belief. I believe that we have universal intelligence. We're all connected. I believe that we have the ability to heal. Personally, it's happened to me in many ways.
Yeah.
So the challenge is to like go to the other team's side and prove the opposite to be true. You know, it's a cool exercise in philosophy, right?
Sure.
And, you know, it's hard for me to just be like, we are not connected. We have nothing. So my argument was just like, well, the benefit of having evidence-based chiropractic, because if you take x-rays, you can measure the curves of somebody's spine, and there's plenty of research to show somebody's in a particular position, what that means for the health of themselves, how are their organ systems functioning. Like they measure conduction times from like a thought to like actual movement in hands, and they find that if you have a subluxation where your vertebrae are out of place, that your nervous system doesn't function as well. Your organs have less energy. So there's a way to measure that, and it's like it gets me fired up to know that chiropractors are allowed to practice without taking full spine x-rays, because one, contrary to a history of crazy beliefs about x-rays, there are x-ray machines today and for the past couple decades that really have a very statistically insignificant effect on somebody's physiology, to the effect of you can, you know, if you x-ray a child, you can x-ray an adult, and there's literature to show this on idealspine.com. If you go to the resources section, they have studies, peer-reviewed journals that are accepted by medicine and chiropractic, not just chiropractic journals, that show that, hey, if you're taking a flight, you get more radiation just being on a 3 or 4 hour flight than you do with 4 or 5 x-rays of your chest. So it's like people are engaging in this activity all the time. So in our profession, there's still these like historical challenges where like people go, well, x-rays are bad. Well, not really. And the literature is showing time and time again that the x-rays are actually not having a negative impact on people. But we still have all these doctors who will fight tooth and nail to be like, I'm not putting radiation in my body. And it's like, well, how I see that as a physician is like, Noweed, if your mother came to me, let's say now you live in Maine, right? And your mom you're trusting me with your mother's health, right? I'm a doctor. I go, well, we're gonna just get her adjusted. We're not gonna take any x-rays. We're just gonna do that. Then come to find out, when your mom was 10, she fell off a swing and fractured her neck. But because she's a total badass and she doesn't complain about pain, she's just been living her life like that. Then, you know, I adjust her and her neck fracture gets worse or something terrible happens, you know?
Yeah.
Or, you know, you take an x-ray of the abdomen and you see that maybe she's got bladder stones. Or, you know, you can see metastatic cancer on an x-ray. You can see tumors on an x-ray. But people aren't feeling that happen. It's like, how can people end up with all of these incredible pathologies and feel normal? Yeah. It happens all the time. So for me, it feels like such a terrible construct to allow chiropractors to not take x-rays, because I just interviewed an Olympian, and he made it all the way to the Olympics. He had a fractured lumbar spine. He didn't know. He knew he was in pain, but he made it all the way to the Olympics with that. You know what I mean? Like, and then to go to somebody who's supposed to specialize in the spine and nervous system and then not take simple measurements of like before and after is crazy to me. And I'm bringing this up, and I'm bringing it back to spirituality, because this is more for the chiropractic listeners. Maybe you're like, hey, we're a DO. We measure all these things. It's super evidence-based. It's all objective. Like we're doing all that. This is normal for you. I'm saying this because it's not normal for chiropractors. And this is the challenge of our industry, because there are chiropractors who do that and there are chiropractors who don't, but we call them the same thing.
Yeah.
I'm okay. Hey, if somebody doesn't want to take x-rays, and it's not to say that you can't help somebody without taking x-rays, because absolutely you can, and it's possible. And people do it all over the United States, all over the world, really. And people are healing of these incredible ailments. But it's just like, well, can we just call that person something different? Because my own mother, I used your mother as an example because my own mother goes to people, and I am saying, hey, this is the best guy that I know in your area. He's supposed to understand about x-rays, like at the highest level. It's like referring your mom to a brain surgeon. Like there's like a group that trains all the best brain surgeons in the world, and you're like, unfortunately, my mom needs this doctor. So you refer your mom to the doctor. I referred my mom to the doctor. And there's supposed to be a group of the best in the world, and he's not even fucking doing a minimum amount of x-ray views. Like, let's just take a look at your neck. Well, she's got a full spine. That doesn't even make sense. What are you doing? So I really love the objectivity of your profession, because I feel like it should just be a standard for any practitioner of health. If there's an objective of your job, let's say you're an osteopathic surgeon and you specialize on shoulder surgery. Like, you're not just gonna cut someone's shoulder open and be like, oh fuck, they got a labrum tear or whatever it is, like, you're not going to find that out by cutting them open. You're going to take imaging to be like, oh, well, this is why it hurts for these 5 reasons. I can see that, like we need that more, in my opinion. And I feel like, I have this conversation with some of my classmates. I'm like, are you willing to let someone's mother, or are you willing to refer your mother to someone and then know that there's a possibility she could have all kinds of pathologies that you could take in an x-ray, and typically x-rays are in someone's office and you just click a button. It takes 5 minutes. It's not like you got to drink this tonic and sit in a CT machine, and then those have repercussions too. It's like, for something so simple, would you trust our profession with your mother, the health of your mother? Like, for me, I don't.
Yeah.
I barely trust that. I don't trust the health of my mother with specialists, which is like sad,
Yeah.
No,
I hear you.
Yeah. And to agree with you about universal intelligence, like, for me, we're focused on this like random conflict. And it's like, I believe that, as you said, if we bring in hope, we don't have to call it whatever religion it is. It's just like, yo, there's power in you. You got energy, baby. Like, there's a reason that you can cut your finger and it shuts by itself. You don't have to go to the doctor. Like, maybe you need stitches, but if you didn't get stitches, like, it might seal up on its own. I got a couple of cuts where I probably should have had stitches, but it just sealed itself up, And just to teach people that that's possible, and give people hope, and connect them with a community of like-minded, high-vibing people. Like, absolutely, the biggest practices that I know, the chiropractors all talk about their faith, and people heal. So I just Shelley went on a tangent, but I really appreciate the objectivity of your profession, and I feel like it's my purpose to bring such clear evidence to chiropractors in a way that changes like regulations, where you could trust your mother in a chiropractic office wherever.
Yeah.
Because at a baseline, you could be like, hey, I'm a DO. I can look at a set of x-rays and actually understand what this is. Like, we could all just have our mothers walk in and fucking know that, hey, actually this guy, what he's saying is that seems right. You know, or like, this guy has no fucking idea what he's talking about. You probably should go to somebody else. You know?
Yeah, no, man. I agree with you. I think we as healthcare professionals we would do our patients a really great disservice by not using the best of what evidence-based medicine offers. The science is there. We have researchers all around the world that are continuously contributing to this library of medical knowledge.
Right.
And it's our job as health professionals to apply that, and to communicate it. And if we don't do that, we're kind of shirking away the gifts and the opportunities that we've been given to heal people.
Yeah.
Like, you can talk to people about God all you want. You still got to do your part.
Yeah. Yeah, it's true. And hey, you know, there's absolutely a sense of community that heals people. Just having a community heals people, regardless of what it is. Hey, people want to get together and beat each other up. They like that. You know, some people want to pick a religion and talk about it. Some people want to race cars. Some people want to watch birds. Like, just getting into a community that of like-minded people is healthy.
Yeah.
You know, getting exercise, like understanding who you can talk to just like be healthier, you know? And I feel like COVID was one of the greatest blessings for humanity, because I feel everybody, no matter if you're a doctor or just a civilian or whatever, like, everyone started to question what is health and how do I attain more of it, you know? And I think that you're saying, you know, hey, there's more of an integration between medical doctors and DOs. I hear of integrations between medical doctors and chiropractors where they have regenerative businesses, anti-aging businesses, where they have a whole medical staff and a whole chiropractic staff. And the thing, like, the people that come out of some of these places are just like incredible case studies, you know, not that a patient is a case study, but they're having case studies that come out that are just insane. You know, like, I feel like 10 years from now, with all the AI and integrations of nearly everything in this day and age, like, we're going to find out that we have the capabilities to help each other in a way that is way more significant than people are giving credit for right now, where the aspects of medicine and the aspects of chiropractic and the nervous system, the ability to have less people be cut open and have failed spine surgery is a CPT code that's diagnosable. And there are people out there, like you said, that are creating research and just connecting all these things. Like, I think it'd be so cool to connect. We know that the nervous system connects to all of our organs, but there isn't a lot of research done in chiropractic. And some of the research that's done is not in very credible journals.
Yeah.
It doesn't mean that chiropractic isn't credible, or that it doesn't mean that the nervous system doesn't work in the way that it does. It means that we're a young profession, and for whatever reason, we had to figure out how to start connecting all of the dots to follow the medical model to really gain any traction in credibility in the eyes of the public. So, the chiropractic industry is transitioning from being we call it principled. If you're a principled chiropractor, you believe in the founding fathers of chiropractic, and these are the guys that were very hey, this is God moving through us. If we just adjust everybody, all these diseases will go away. And there are stories and recorded stories of people with epilepsy, freaking different types of cancer, different tumors, asthma, cardiac problems, liver problems, like that, Parkinson's disease, like diseases that people say are uncurable, and they go and they change the stress on their spinal cord through particular types of chiropractic, and they have these spontaneous remissions of all these incredible diseases. There's plenty of cases of that, but there isn't correlating research to show consistency, which I believe will come in due time.
Yeah, and I hope it does.
Yeah,
that sounds like you're going to be and God willing, inshallah, a pioneer for this.
For sure, man. I think that my purpose is just to connect people together. Like, I really, whenever I'm praying, I feel like that's my whole deal. Like, I just got to be going everywhere, connecting all the people. I don't know if I will be the most educated in one thing, like I won't be like the best at one thing. I think that I will know every person who is the best at one thing. And I think that I'll be able to bring them together so they can just create the best information. Like, I will be the best uniter of the smartest people on the planet for health. Like that's my goal. I just want to put them in the same room and be like, watch this, like,
I love it.
Yeah. But vicariously, by knowing all these people, I'll probably know a fair share of what's the best. Yeah. So that'd be cool.
Yeah, I'm excited. I'm excited for you. I'm excited for both of us.
Yeah, dude. Because, like, can you tell us a little bit about your Gap DX?
Sure, yeah.
Yeah, dude, because for those of you that don't know, you could already tell. I mean, we've been on here for an hour and a half. Noweed is one of the smartest people. I bogarted a little bit of the time, but I got fired up. So anyways, let's hear.
I'm glad you shared
your Gap DX, bro, because it's freaking sick.
Thanks, man. I appreciate it. I think so. What I've noticed going through medical school and just through my experiences in medical education is there is a systematic disconnect across medical schools in the country, whether it's MDs and DOs, and the licensure exam expectations. And there's a lot of merit to it in that medical schools have a job to prepare you to be a good doctor. All right. The licensure exams, their sole job is to make sure that you know the information that you need to know to get into your residencies and recognize diseases, recognize the pharmacology, the microbiology, and think like a physician. And you would expect that these two things always line up, but that's not necessarily the case. There is philosophy involved, and there is also the context of understanding what it means to be with a patient in the clinic, understanding, okay, what do I do next? And what are the steps that I need to take to be able to diagnose what this illness is. And so the point is you've got these two parties, the licensure exams, and you got the medical schools that are working towards a common goal, though there is a gap in the communication and the expectations of what that means. There's not a standard per se. And my goal is to work towards building that standard. And I say that with as much as ambition as it sounds. I want to be able to help give medical schools the tools that they need to be able to assess their curriculums and to within the scope of the bureaucracy that are in medical schools. In medical schools, you have your curriculum committees, and then you have on top of that the administration, and below that you have the professors that are actually making the content. And to this day, it's a lot of manual back and forth, plus stack on top of that the actual metrics of how students are performing on the school exams and the licensure exams. And it's a lot of management of information and people in an environment that is constantly changing. You know, we alluded to the fact before that research is growing at an exponential rate, and it will continue to, especially with AI. And because there is so much friction in the communication between all of these parties within medical schools and then outside with the licensure exams, I think that the divide of what is expected and what is being taught is only going to grow unless something changes. And so my goal in this product is creating a licensure to curriculum coverage tool. And so essentially curriculums, schools, institutions will be able to use this tool to assess their curriculums and say, hey, are we covering what the licensure exams expect? And are we doing it in a way that is actually teaching our students to evaluate and analyze the information that we are giving them? And I've spent almost the last 9 months developing this, and I'll be piloting my research within the next few months. Actually going out and building the platform is something that has been a great deal of joy for me because I believe in the mission. As a medical student, I felt the divide, right? And I was a part of, so for my school, I was the OMSGA president, which means that as a member, I represented my school in a larger organization where all of the presidents of the DO schools were connected. And I can say from my own experience interacting with the presidents of each one of these schools of the different medical schools across the country, this isn't a problem of one medical school, and it's not the fault of any one medical school either. This is a more of a reflection of a constantly changing environment and something that needs, I think, better tools.
Yeah.
And granted, I'm a student, I'm doing my best. And in that context, I understand that we are an evidence-based profession. And so my intention is to go out there and prove that this works, proves that we can indeed do coverage analysis of curriculums and compare them against the boards and reliably be able to assess where there are gaps. There's a ton of technology involved in all of this, and I am enjoying the process, man. Just learning and building and hoping in a future where we can really bridge that gap and we can do it in a way where we can keep up with medical science, and our curriculums can do that. Our professors who work so hard and our administrations who work so hard to make this happen and make sure that they are putting out good doctors out in the world have the least amount of friction possible. And in reflection of that, students, medical school is hard, man. All right.
Yeah.
Medical school is so freaking hard. And if we can reduce the barriers, if we can reduce the friction for getting talented and smart, intelligent individuals to become physicians, then I want to be a part of that.
Yeah. That's cool, dude. I mean, what do you feel like the biggest gap that you're seeing is? Like, is the consensus between all the schools like something is off? What is it that's clear?
Yeah, so my understanding is you have larger licensure boards and committees, people that actually like boards that will actually license the schools and require that the schools teach X curriculum and that their students perform well on the exams. And so as long as your students are passing the boards, then your school should be good, right? Curriculums and schools have a curriculum map, and it's something that they submit out to these licensure bodies, and there's a lot of work done to actually approve this out. But when you go into the nitty gritty of the curriculum itself and into the lectures, you'll see that, okay, yeah, you say that you're covering this, but the information that you're teaching me on this lecture is actually different than what the boards are asking me to know about this. Sometimes you'll even see like outdated information. And so that being said, the regulation is there. The regulation is there, though the tools have yet to catch up. The tools have yet to catch up. And that's essentially what I'm trying to develop here.
Right. That's cool, bro. I mean, I think that what are your guys' pass rates of the tests? Do you know? Do they tell you guys?
Yeah, to my understanding, our school, for example, has like a 98% pass rate for our exams. And I would kind of split the credit on that between the school and then the students themselves. Nobody goes into medical school as a lazy person, and if you do, you're not going to make it. There is a huge when you are a medical student, you better be ready to do whatever it takes to succeed. Even if you don't feel like you're getting the support that you feel like you need to from the curriculum itself.
Yeah, yeah.
So there's a huge culture amongst medical students across the country where medical students are going to third-party resources to learn this material. And so you have huge medical libraries and test banks of these multi-million-dollar organizations whose entire sell is to help you prepare for your boards and your licensure exams. Now, well, no, these third-party resources are. That's the point. The point is I'm going to medical school to learn this stuff so I can pass my boards, but I'm not learning the stuff that I need to in medical school to pass my boards.
Right. That's what I meant.
Because of that, now I have to go and pay
more money,
way more money, a lot more money, and learn from these third-party resource companies to actually prepare for the boards. That's friction, bro. That's friction. I'm going to medical school to learn how to be a good doctor and pass my boards.
You get your certificate, and you're paying a lot of money to do it. It's definitely not just like a walk in the park. Yeah.
No.
Yeah. So Cool. So then, that's a good idea. We have 90+% pass rates as well, right? Where maybe the school would argue like, yo, we don't have a problem in this department, right? Which could be a fair argument based on statistics for your school or my school.
Sure.
It almost feels, right? Well, this is not a problem because everybody already passes.
Yeah.
But listen, I'm not saying that that's the solution at all, because I think that there's absolutely part of what we learn that, is missing as well. Like sometimes there's a disconnect. At our school, there's a lot of administrative challenges right now. Our school is like the Harvard of chiropractic. It has the most exposure to every kind of. We have the most clubs, essentially, like the student involvement and in all the different specialties of chiropractic. Like from day one, you can be in I'm sure there's more than 50 or 60 specific chiropractic clubs at our school. There may be even more. I could be underplaying it. There's a lot of involvement with people outside the school and people inside the school. That's like our big claim to fame. And all these other schools don't have those clubs. They have maybe 5 or 6 clubs, if that. So then all these other chiropractic students essentially are having to go outside of the school and pay for all these seminars to actually learn how to be a chiropractor, because the school doesn't necessarily equip you with everything that you would need to just like start a practice day one. Yeah. It's not to say that you don't learn or you couldn't do it. There's just bigger gaps that could be filled. But what is ironic is the school's claim is that all they're doing is changing the curriculum to only focus on the boards. Because previously at our school, they had more electives. So you could just use your education to, instead of have to go pay this guy, you could just take it as a class and it would count towards your degree. But what they were finding was that then the board scores started to go down because people were focusing on things that were relevant to being a doctor, but not relevant to passing the boards. So it's kind of ironic, right? I mean, like now the school is just solely based on, hey, we just need to get all these kids to pass the boards, which is it's a great thing. So I think that your industry has a wealth of support and definitely enough financial backing to be able to create or adopt this Gap DX that you're creating, to support the mindset of the students. You know what I mean? Our profession, at least like the colleges, it's so funny because like our schools also claim is that they are principled, or they teach people a philosophy of medicine and chiropractic and just health. We are a principled school. We teach the philosophy of our ability to heal each other, human connection. I don't know. There must be stories in the Quran of people healing each other in miraculous ways. Is that true?
Yeah, I mean, frankly, even Prophet Jesus, all right?
Yeah, right.
Prophet Jesus brought a man back from the dead.
Yeah. Yeah. Right. I mean, it's cool. So our school talks about that, so let me ask you this. how do you think your experience would be different in medical school if they brought a spiritual aspect to it? Not necessarily a named religion, right? It's not that. It's just like talking about our energy, connection to a source of energy, connection to each other.
I'm not sure. I mean, if they brought in some context of like non-denominational or non-affiliated spiritual context, even then I would argue there's still an affiliation. Whatever you believe in spiritually, there is a belief backing it, whether it's the modern context of agnosticism,
right,
or this like modern context of what spirituality means for people, which I think there's the shared relationships between any spirituality, which I think are based on the principles and values, right? Which I think medicine does a decent job at capturing that, like in the ideas of beneficence and non-maleficence,
right,
virtue, of having virtue and justice, these things which are derived. I don't imagine they could be derived from anything else other than spiritual excuse me, spiritual based practices. Now, to bring something into the medical curriculum about the context of spirituality, I don't know what they could have shared with me that I would have truly resonated with, other than shared values and principles. If they were talking about, well, even in the context of talking about the interconnectedness of of all human beings, because I follow Islam, I'm looking for proof. Whatever claim that you make about spirituality, I'm looking for proof, a proof that's based in the Quranic context, or in the hadith of the Prophet Muhammad, peace and blessings be upon him. And so they could teach me something that sounds cool in theory and might even give a positive spin on something, and I could say, okay, yeah, that's cool, but not necessarily how I'm going to practice, because my I would say the application of my logic or problem solving in the context of religion is defined, is frankly, it's quite defined. Now, again, if it's in the context of what it is now, beneficence, non-maleficence, having integrity and dignity, being truthful, all of these things, they exist within the context of medicine, but we define them as ethics, right? They're within the context of ethics.
Yeah.
In the context of morality is very difficult to define from a spiritual perspective, especially in this demographic and context. Because
cultural,
we're all different. We all came from different backgrounds and different countries and different religions. So even in the context of what you mentioned, like the interconnectedness of all human beings, and the universal and innate intelligence, these ideas have roots in different philosophies and different religions. So there is indeed a sense of relatability to it.
Right.
And I appreciate that. I do believe that physicians specifically need to be taught how to be good people, and that doesn't really exist so much in the sense of like philosophical studies. We have our ethics courses. We know what we're supposed to do, but where is the accountability? The accountability comes from our homes, from our communities. It's the same thing as growing up in this country and going to school, man, like public schools. Like, okay, your teacher could tell you, hey, raise your hand, be polite. And it's like, okay, well, yeah, I could see the benefit in that. But if I don't do it, then you're just going to send me to the principal's office, and then I'll be back in 2 days.
Yeah.
Whatever. I don't know. You know what I mean?
Yeah.
So I don't know. I don't know how much it would have changed my practice, because I think just in the context of growing up in this country, I understand that my morality, my spirituality is my own. I've accepted that in becoming a physician, I'm aligning myself with the ethics of what it means to be a physician, which frankly I don't disagree with. Now, I'll give you a context, like an example of where maybe I would do something differently, right? So on one of my board exams, there was a question about a physician who was a specialist working in a rural area. And there was someone in that rural area that needed that specialist's profession. They needed help from that specific specialist. And so the question was, well, if this specialist denies care to this person, are they legally or ethically responsible for that? And the answer was no.
Right. I would say
you haven't created a physician-patient relationship with this person, then you don't have a responsibility over that person. And that's in the lawful context, right? Like, we're talking about law. Now, if you ask me personally, I would say, well, I get that that's in the court of law. You don't want to be held accountable to that. And in the same context, you are a physician and you're responsible for this community. So figure it out. If that person needs your help, then you help them. You help them. And granted, we're all human beings and we all have a capacity. So this physician is already working 12-hour days and he has to go see somebody else, and it's taking away from his family and his livelihood. Like, all of that needs to be considered in consideration. But who's going to tell you what the right choice is?
Right.
That's yourself. That's your relationship with God. That's your community. That's your wife. Does your wife say, hey, no, you need to be home by dinner at 6 p.m.?
Right. Or you need to go help this person.
Or you need to go out and you need to help this person. This person needs your help. You have the tools to help them. You go and help them. I hope to have a household like that.
Yeah, for sure. Me too. I do. We do. So this is the thing too, where it's like, okay, well, I'm curious to I hear what you're saying. Absolutely. And I'm curious to understand your personal opinion about, do you feel like you have the ability to like heal people with, well, I guess I'm realizing that we're talking about healing people with our hands as a chiropractor, right?
Yeah.
There's a physicality. Do you feel like, regardless of if you're whatever profession you are, if you are a human being, that you have the capacity to heal another human being with your physical body or your energy or your presence? Do you think that is, do you think that's true?
Yeah, absolutely. I think that healing is not something that belongs to physicians, right? As physicians, we are learning the best applications of the science that we possibly can and then applying it.
Right.
And that is one aspect or one way of healing. It's just as healing that if you just lost your husband, for example, you're a widow and you're stuck, and your sister flies in from another country and comes and spends 2 months with you, just so that you have emotional support and someone who can cook your meals for you and take care of you and hold you when you're crying and heal you through one of the darkest parts of your life. Whereas maybe if you didn't have that, the stress would literally kill you. You would develop cancer, or you would develop gastric problems, or some stress-induced hepatitis or otherwise. Like, God knows what's going to happen because of the stress that you're facing. So anybody, every single person in this world has the capacity to heal through love and through care and through good intent. And granted, on the opposite edge of the sword, good intent is not enough. You need knowledge. You need knowledge. You need to have wisdom. You need to be able to apply a like deeper understanding. I mean,
Yeah.
just think about in context of our like cultural traditions from our own households,
Yeah.
and the idea of, stick a clove of garlic up your butt, like, and that's that's gonna clear your cough or some illness. And it's like, grandma, like, I don't think that works. And
Yeah. She's like, but I've been doing it my whole life and it works.
yeah, you know what?
Yeah.
So, maybe it does, maybe it doesn't. I haven't read the research on it. That doesn't mean it's not true. So
Yeah.
good thing to ask
You
questions.
have to find a cohort of people who are willing to stick a piece of garlic up their butt.
Yeah.
Yeah.
Bare minimum, though, we all should be asking questions. And I think part of the benefit of being trained as a physician is just problem solving.
Yeah.
And oftentimes the solution is not something that you read in a book. It's words. It's words. It's the way you talk to people. It's the hope that you give them.
There are chiropractors for sure that are less skilled, but they are better communicators and they see all kinds of incredible healing. And there are chiropractors who are the most skilled, but they can't communicate for anything and they don't have people stay long enough to use their skills. They literally walk out the door. Communication is such a massive part of how chiropractors heal, because it takes repetition in order to change the curves of someone's spine. It'd be like going to the chiropractor. It'd be like going to the dentist and him like punching you as hard as he could in the teeth to try to make them straight in one shot. You know what I mean? It's like, well, you got braces. You're gonna have to wear them for a while because you got a jacked up smile, bro. So you're gonna need to sit in these braces for a while to make it straight. I mean, it's nobody questions the dentist for keeping braces in your mouth for a couple of years because people just understand that it takes a while for those bones to move. A chiropractor can move bones faster than a dentist can, but it's not going to be a punch in the teeth either, So I feel like it's really fascinating to have this conversation with you, just because I realize how much we're at our school. There are other schools that teach chiropractic in a very clinical way. It's just I wouldn't even say it's evidence-based to the highest level that it could be. It's just very much musculoskeletal. It even has less to do with the nervous system than a couple of other schools. Most schools are just talking about joints and joint function and how to get joints moving, which is very remedial compared to talking about how the joints are affecting the nervous system and the interconnectedness of organ function in the nervous system, and our school really focuses on talking about and bringing people in who heal people with their hands. It's a very intimate exchange between one another, especially, people, having your neck adjusted can be it's trust. I mean, really, it's a lot of trust. And so, it's fascinating to have this conversation with you because I guess I'm recognizing how unique of a not only school, but just like a experience that I have personally had to, I don't know. I think I was just meant to be in this thought where how do I show people how powerful they really are in their ability to heal themselves and the people around them, you know, like through faith, through community, through their nervous system by way of chiropractic, like through functional medicine, you know, eat healthy, through exercise. Like, I just want to show people how powerful they are, and their body's going to heal, you know, like their mind is going to heal, their spirit is going to be able to express itself in a way that their mind isn't blocking, you know, the whispers of God aren't drowned out by the screams of our thoughts sometimes, you know? So it's cool to think that there is this, it's like necessary, I guess, a spiritual component of chiropractic, because in order to, like, first of all, the public doesn't really care about how cells divide and energetic, you know, like electronegativity. They don't care about biochemistry. They don't care. They just know that they can't pick up their granddaughter because they have, you know, their back hurts. They can't drive their kids to school. Like, a mother can't hold her own baby. You know, like, these are the problems that people come to us with. I got in a car accident. I can't work anymore. You know, they don't give a shit about all this other actually incredibly fascinating things to people like you and me, because we're like, show us the proof, and we're like, holy fuck, that's crazy proof. You know, that's how the body works. That's nuts. You know, they just want to pick up their freaking kid. You know, so how do we inspire people? And this, I think, when I think about healing, I think about communication. You know, like I said earlier, you could be the most incredibly skilled family doctor, but if people walk out of your practice with a bad taste in their mouth, they're probably not going to come back to you. Now, you could be completely Asperger's surgeon, because some anesthesiologist is going to put them under, and you just cut them open, and you just be all you can be. You don't have to have the communication as much. You could just be like, well, this is what's going to happen, and you don't got a choice because you fucked yourself up. So I'm going to cut you open and sew you back together. You know, you could just kind of have that face level interaction. But if, you know, like what you're talking about is rehabilitation. I mean, you're going to see people all the time. They're going to be coming back for months because whatever happened. Yeah. So, you know, the reason that people would choose you is your ability to communicate with them, and your ability to inspire hope, as you said, into their next part of life. Like, I get you literally were riding a motorcycle, running marathons, and now you can't stand up. But through this process, like, I will help. I can show you how to find hope within yourself and how to believe in yourself. And I can show you how your body will heal. And I can show you how to walk again. And it's going to be painful. So, like, you know, I see a lot of correlation between at least the PM&R that you were talking about. If you went down that road, and how I would handle someone walking into my practice as well, where we got to see them for months in order to rehabilitate what they're coming in for. And to me, there is this aspect of communication that I feel like is through body language, through how you touch them. How are you, you know, I don't know if they tell you this. I'm telling you this as your friend, just because I think it's the most important thing that I've learned, is that, like, if I touch someone's shoulder, like, I want them to feel my energy. I don't want to have to shove them against the wall. I just want to be able to walk in the room, and my energy has so much presence, they're magnetized to it. And they want me to touch them because we have the power running through us. And the way that the words that we choose to tell them empower them, the feelings that we give them, the way that we can connect a spouse, maybe this gentleman was riding a motorcycle and his wife walks in and she's small, but he's 6'5", and he can't get himself out of bed, but she's 5 foot. She has no way she could pick up this man. So not only are you going to have to teach this giant ass dude how to re-walk again, you're going to have to coach his wife on how to help him because he's too heavy.
Yeah.
So we're going to have to become marriage counselors, because if you're just focusing on this guy, he's going to ruin it. His relationship might fall apart because one of them is insecure, potentially him. Maybe he's a freaking dialed in and he thinks that everything's going to be all right, but because she's so small, she doesn't even know if she's going to help him wipe his ass. You know what I mean? So like the way that we communicate with these people becomes so much more relevant. In the way that we touch them or give them a hug or whatever it is for me becomes so much more important, because I choose to share the responsibility of healing with God and just go, hey, I'll be here. I'm going to move the bone. I'll communicate with them, but through my body and through their body, make a connection and help them heal faster. For me, it helps me let go of how. Yeah. I don't have to know how. I just have faith that whenever I touch somebody or they come to me, that there isn't a better person that could be in front of them to heal in that way. Yeah,
no, I resonate with that. I resonate with the understanding that when we do what we were trained to do with the best of our intentions, that the healing itself comes from God. And God's majesty and in his wisdom created our bodies to heal themselves. And so if we can help that along, if we can facilitate that through, like in your words, with our hands, then that is a beautiful gift. That is a beautiful gift. And that is a tool for us that, in the context of like my education, I'm grateful, has been captured. The idea of using our hands is literally fundamental to what it means to being a DO. One of my professors, I love her. She gets so fired up about patient care. And she's told us multiple times that if you're not using your hands, like if somebody comes into your practice and you don't put your hands on them, you are not doing your job. And I would say, in the broader sense of medicine, that it is something that needs to be practiced more. Like, I don't know many doctors, truth be told. Even my primary care practitioner, I go into their office, they're not putting hands on me. And the beautiful thing is that I know better, and I hope to be that practitioner that when I go in and a patient comes in, I'm running the tests on them that need to be tested. I'm doing the exams on them and actually checking them. And then if I can help them with my hands reduce some pain or increase their circulation or reduce some stress with my hands, then I have that ability. I've been trained to do it. And I have to trust in that and trust in God and his healing and do it.
Thank God for this.
Yeah.
Totes, bro. This is a pretty good thing. It's the thumb, not the pinky. I know all you guys are thinking it's the pinky, but it's the thumb and the pinky. This is what helps us heal people. This movement right here.
There you go.
True, man. And here's the thing where it's like, if I was to go 1,000% on just being like, I'm putting all my faith in these hands, which a lot of people do. There are absolutely, without a doubt, in history, people who have only had their hands and helped people heal from incredible traumas, thoughts, toxins. But I will say that ironically, the X-ray was invented in 1895, the same year that chiropractic was invented.
Hmm.
And the first person who ever practiced chiropractic used X-rays.
That's cool.
I know. I'm just saying. I don't know why people don't do them. So all I'm saying is, like, we have this incredible power in our hands, but if you had an X-ray, as you said, like, you're using every tool possible. Like, why would you not do that? It's so silly to me. Why wouldn't you just use the most easy, non-invasive picture to see what we're doing, bro? It's like silly. Yeah. Well, how about that?
That's right.
If you could say, like, in 10 years from now, where would you like your own, like, self to be, at least? And, like, if you could take 50 years from now and just, like, smash it into the next 10 years, like, what would happen for medicine?
Okay. So I'm thinking about the next. What would I? Okay. So the question is, what would I accomplish over the next 50 years if I could do it in the next 10?
Yeah, like, for medicine, like, your profession, like, if you're like, all right, all these things, we're just gonna compact it. If we're gonna take 50 years and just do it in 10, like, no big whoop. We're gonna
Jeez.
make this happen. And then after you answer that, like, what do you see for yourself in the next 10 years? Like, when you're at that point, what is it?
Okay. So first, in the context of medical education, I want to address what it is that I'm working to address right now. I intend on making the journey of medical education something that is sustainable and moves with literature without friction. I want the connection between our schools, between research and our licensure exams to move with the least amount of friction possible, and for students to be able to learn what they need to through medical school. They can they can learn the medicine, and they can learn what is expected of them on the licensure exams, and they can do it through the medical curriculums. That is my goal. As far as medicine and the broader context, eventually I'd like to be involved in health policy. And a big part of my goals with health policy is about making medicine more accessible. Med- Medical care just in general is so expensive, and it puts tons and tons of people in debt that they cannot handle. And from the bottom of my heart, I believe it should not be that way.
Right.
And if and when I have that opportunity to work from the aspect of policy, it'll be to address these systemic issues in whatever capacity that I can, and put my best foot forward into it. And otherwise, man, just heal as many people as I possibly can. Heal as many people as I possibly can over the next, hopefully, 50 years of my life practicing medicine and being a doctor and being dignified and holding myself to good character. How would I change medicine? How would I change it? I would hope to make physicians, I would hope, I would hope for a day when physicians have humility before their patients, where they can communicate with them and they can speak to them with compassion, and they they live as the most upstanding citizens of their country, because that's what I believe physicians should be. I believe physicians should be standards of character. I genuinely do believe that. And I don't know how that stuff is going to change. I pray that it does. And I pray to be an example. That's the best thing that I can do, man. Be an example. Right now,
Yeah.
what I have in front of me is something that I feel like is actionable about like medical curriculum. I saw the problem and I'm working on a solution. And I think that and I believe it's attainable. I do. I
Yeah.
genuinely
Yeah.
believe it's attainable. And I see the path for it as well. It's still building and still developing, but the path is there. About building character and just building a better generation of people who get into medical practice, that's frankly out of my hands. It is. It's out of my hands. And if I can contribute to that, and how I will contribute to that is just by being the best that I possibly can be.
Yeah. Yeah. For sure, dude. What about personally? In 10 years, outside of your career, where do you see yourself?
I think in simple terms, a better man than I am today, closer to my community and my family, and I would hope married with children and be able to live a balanced enough life where I'm there as a father and I'm there in every role of my life that's important to me, as a man, as a husband, a son, a brother, and a physician, and be there for the people that I love, everyone that I love, including my patients, and and a man of good character. That's it. I want to die a man of good character and a man of belief. That's my prayer. I want to die believing in God and being a good man and someone who has repented his sins. If I can do that 10 years from now, then I'd say I'm successful.
What? That's pretty good, bro. I mean, you're. I don't see that there would be anything that would stray you from that path that you're already on now. You're like, you get stronger and stronger by the day. You know, that's cool. You got a good vision. And if you don't know, Noweed wants 18 kids.
Yeah, I mean, 24, why not?
Yeah, one exactly, bro. I like your style, dude. You're so hitting it right on the nail, you know? 24 kids is the best, bro. You know, it's so funny because Bella and I have been talking about our goals. I created a course because I've been. Are you familiar with Grant Cardone? Do you know Grant Cardone?
Yeah, you mentioned his name.
Yeah. Okay. Anyways, here's the whole thing. I've been trying to build a business because I went through the coaching certification with him, and then I'm like, okay, well, I am really attached to things that I feel are like principled, you know, or they have purpose. And I'm less attached to a dollar amount, even though I understand that it will take multi-millions of dollars in order to fulfill the idea of community and purpose and contribution that I foresee for myself. Like, it's going to take multi-million dollars to influence the world of healthcare. And so, like, I don't know exactly how much, you know, I have no idea. I don't know what it is. Like, there's a kind of lifestyle that I would like to have to be able to also support my family. You know, I want to be able to take care. I talk about my mom all the time because I love her, and I just want to be able to take care of her. You know, like, she don't have to worry about anything. She can come chill or whatever. Like, I will have enough funds to support not only my family, but my mother, like my aunt, if she needs it. She's probably don't need no help. She's doing pretty good. But, Bella's got brothers and sisters. She's got family that may need help. Like, I just don't want to come up to this place where, like, oh, you have a family member, they got to suffer because maybe I didn't contribute to the world as much as I could have. So now I have to watch a family member suffer. And not to say that every family member would accept help anyway, but I don't want to be in a position where, like, I could have contributed something more to the whole planet and been compensated financially for the contributions I made to the world, or didn't do that because I was afraid. And then now I have to watch somebody close to me suffer, and money is the limitation,
Yeah.
Like, I could know exactly where they have to go, but there's just not enough funds to make it happen. You know what I mean?
Yeah.
I don't ever want that. So I created a course to go, well, I don't know if it's like, if I go, I just need to make $10 million. Like, to me, it means nothing. Even though I could make it $100 million, 50, 700, a billion, I'm just saying numbers, But I created a course to go, how can I design the life that I want and just remove how? Like, take away how it's going to happen, just like define the relationship that I want with my partner, the relationship I want with my family, what contributions I'd like to make to the world, to what sort of charitable contributions I'd like to make, what sort of lifestyle do I want to have, like, do I want to have, like, what kind of recreational activities, like what, time that I can spend, like I want to be able to spend time with my family, and be able to, I want to go all over the world and teach people about the greatest way to heal people that we've figured out so far,
Yeah.
So I write all these into the system that I'm creating, and then it comes up with a number. And then you essentially just go, wow, okay, it was far more than I expected. And then you go, okay, well, where am I at now? And then you essentially just create decisions to move you towards that goal. Like, how do I build the bridge from here to there? Because it was 10 times more than I thought it was actually going to be. You just use the AI to figure out all these aspects of a lifestyle that you're unaware of, because, one, I don't know people who are doing what I'm trying to do. So there's no reference point of how much it would take to do it. And two, it can just, like, compile it all and be like, dude, you need to make $19,378,540 a year to fulfill this purpose that you have just stated on your workbook or whatever. So it's fascinating because I'm like, all right, well, Bella, at the beginning of our relationship, brought up, not flying on a private jet because it has more emissions, because, Grant Cardone has a jet and he's flying all over the world to help people out. And so, I'm trying to think of, like, all right, well, how many trees would it have to take to plant? Like, what is the equal and opposite contribution to the environment? Like, trying to figure all these things out. It's fun to think about on such a massive level. Like, well, if I take one flight, you have to plant, 50 million trees or whatever it is. Like, you have to build a rainforest, which would be, all right, well, I don't have to know how, but I just have to define what it is first, So anyways, I saw this thing on social media the other day. This guy, he essentially just built a compound, so he doesn't have to fly everywhere. And he created more time with his family because he was able to go, the non-negotiables for his marriage and family was he doesn't work after 5 p.m. He doesn't work on the weekends, and something else that was an incredible limitation for a man of his stature. Like bringing, hundreds of millions, maybe multi-billion-dollar company. He's got very limited parameters. So he's like, how do I how do I respect my wife? How do I respect my family? But also like be like number one in my purpose and mission. He builds this compound and he just has a main house. And then he has a separate building that is meetings and work. And he's got acres and acres and acres of land, right? And then he has another house to where all of his family, they just come and spend time at this big compound. Everybody wants to be there anyway. So now he basically just created a whole ecosystem for his specific role as a father, as a husband, as a brother, cousin, extended family, son-in-law, whatever, plus all of the work obligations. And now he doesn't have to fly nearly anywhere. Everybody just comes to him because he's number one. So everybody would come to him, which I thought was such, I keep telling everybody the story to try to put it in my brain to like build a compound for something that I'd like, because that sounds like an incredible life. Like this man is not sacrificing his family for success of purpose and career, which a lot of times you see this like inverse relationship between family time and career.
Yeah.
You know? So, hey, thanks for the internet also being able to connect us. And we're not even in the same state. We're across the whole United States and we're able to have this conversation.
Absolutely.
But I feel like, hey, whatever we do, you and I, brother, we are so like similar, like all the time. Noweed and I have known each other, like we said at the beginning, like nearly 20 years now, since we were 14. I was 14. You were 14.
Yeah.
Right?
Yeah.
Yeah. So, that's literally one more year. Maybe you have a year and a half, but for me, it's one more year.
Yeah.
So, we started going to doctorate school. I mean, you've been on this journey for longer than I have. I had to go excuse myself from life for a while. I went to the military for a little bit. Ironically, now, Noweed is in the Army, an officer. So cool. So we swapped places there. But we'll be doctors at the same time.
That's right.
I know. And we both have a vested interest in like the political aspect of and bureaucracy of our fields. Come on, dude. I'm thinking about it in this conversation. Like, was there something that we ate when we were, was it Coach Atwell's watermelons that just made us freaking
Probably.
awesome? Yeah. You know what I mean? What was it? Was it all the runs in the desert together? I mean, I don't know, bro, but something about it. We are like literally on such a similar life path, and we both want to make the same change. I think what's supposed to happen, buddy, we're supposed to come together. We're supposed to just figure out how people heal the best and then tell everybody, regardless of what everyone wants to believe.
Yeah.
Regardless of their team colors, or just be like, guess what? Noweed and Dalton figured out the greatest ways to heal everybody. I think we should adopt things from each other. The medical field could adopt some love and connection with their patients from chiropractic, that hands-on healing, and chiropractors could adopt the freaking evidence-based stuff more. The literal healing of things, proving time and time again with certainty and accuracy. It's out there, chiropractors. Chiropractic Biophysics. Just go look on their website. They got peer-reviewed journals. And you DOs and MDs out there, you better make some chiropractic friends, because we all hug our patients for the most part. There's very few chiropractors that aren't hugging people on the daily. So, is there anything else that you feel like would be important to?
Some closing remarks.
Some closing remarks.
I think I would go back to something we talked about earlier, which is just the idea that anyone can heal.
Yeah.
And I think true healing comes from the heart. Evidence-based medicine and love, faith are not things that are exclusive to one another. And we, as healthcare professionals, are in a special place of responsibility where we learn the evidence and we're taught the love, and we need to apply both. And that I think is it's not anything new. We're not the inventors of healing.
Yeah, not even close. Yeah, totally.
So yeah, I'm grateful for this, bro. I'm grateful to have had the opportunity to come on and hang out with you, talk to you, especially on your birthday, no less.
Yeah. Woo!
Yeah.
I wouldn't want to be doing it. I was so excited for this to be my birthday podcast, really.
That's wonderful, bro.
Yeah.
I'm grateful. Now I get to go do my prayers, take care of some stuff for my house, for the household, for my mom, for my dad.
Yeah.
And just keep getting ready for rotations, man.
Yeah, dude. Well, Tuesday, bro.
Yeah, that's right.
You better understand what everything is happening in the rotator cuff, or someone's arm's going to fall off.
Yep, sure thing.
Yeah, dude. Sounds good, bro. Well, I love you. And thank you so much for coming on. This is one of my favorite ones, dude. I learned a lot. So thanks.
I appreciate you too, man. I love you, brother. Thanks for having me. And well, no question about it. We'll talk soon.
Yeah, for sure. All right.